At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live, and it is a Sunday, and it's a Sunday before Thanksgiving, and you know what? We're coming up close to the end of the year. So I want you to kind of sit back and take stock of you. I want you to take a look at, your body and, all that, I know I need to do this, I know I need to do that, and kind of take a deep breath of air and find out why you may not be initiating the activity, the changes that will move you forward to a place of a far better health condition platform, if you will. And why am I talking about that? Well, we're in the time of the year because, we're in celebration time. And right now we're at least calm in this country. God willing, we'll continue that way. But we're at a place where in celebration, we sometimes put things into our bodies that we know that are not good for us. And it's often the straw that breaks the camel's back. So, well, I can get away with it now and it'll be okay. And I'll take care of it later on. And a little bit won't bother me. And it leads to some, in many cases, some devastating problems that become life-changing, slowly, insidiously breaking you down. So I want to, before I get into the meat of what I'm talking about and following through into the live stream immediately after the program, I want you to take stock of where your health is and the things that, you may not be doing quite as well as you should. You think you are, you're about 95% there, but you haven't given yourself that healing window to make a difference. And you wonder why you have all these things coming up. But the problem is now with the holidays, you're going to eat things, and particularly the amount of sugars and alcohol and refined foods and so forth that are going to go into your body are going to cause a cascade of inflammatory reactions that are going to bring all these symptoms, and particularly the ones that we're going to talk about today and the conditions that we're going to bring about. So what are we talking about? We're talking about the different types of neuropathy. You've heard it on, people advertising, we have neuropathic remedies. If you have numbness or tingling or can't do this, you can't do that, come and let's check you out. Well, I'm going to take the veil off of it today. And over the next few weeks, we're going to talk a little bit more about it. And we're going to end up with a program this coming December, coming up in a few weeks at the Roselle Center for Healing. We'll give you that date as we go through. But what I want you to understand is that in the majority of cases, you can, one, prevent this from ever happening, but two, resolve it. But it's up to you as well as your doctor to be cooperative, to be partners in the application that'll need to turn things around. So let's get into it, and we're going to kind of take the veil off the puzzle, if you will, right? So, and oh, by the way, I want to remind those of you who are patients of the Roselle Center to make sure you check your email ongoing right now, because we've sent you a very special gift, something that says here, thank you, we love you, please use it, and put your health back in a better place. Check it out. If you have any questions, you can always reach out to rosellecare.com. That's ROSELLECARE, rosellecare.com. And we'll give you a further explanation on the subject. But let's talk about this thing called neuropathic pain or peripheral neuropathy. And what it is, it's a disease, dysfunction, pathology of some sort that affects the nerves of your body. And it starts from the central portion of your body, the spinal cord, going all the way out into the periphery, meaning, where the nerves end up, right? So peripheral neuropathy is something that you really have to understand so you don't get seduced by a lot of the ads that are out there that can cost you not only a few $1,000s, but sometimes tens of thousands of dollars. And they say, well, there's no guarantee. Well, I'm here to tell you that if you do things the right way, and we've been treating neuropathic pain for my entire career, and the results can be extremely, extremely beneficial. Now, the problem that if you go to the end stage, and we'll kind of take the veil off of that as we go through, is the destruction of the protective covering of the long nerve roots that go to the feet, the muscles, the hands, the face, and so forth. And that's called the myelin sheath, Myelin, myelin sheath. And that myelin sheath can be irritated for a lot of reasons. So neuropathic pain, neuropathy, can affect different nerves throughout the body. And we're going to talk about that a little bit. And we're going to much more specifically as we get into the live stream. The different nerves will begin to express as certain types of symptoms. And it's really important that the doctor that's treating you understands what the symptom presentation is and where it's coming from, but more importantly, how to diagnose relative to its application. There's, in this particular thing, there's no one size fits all. We know that neuropathy is treated with acupuncture, it's treated with low energy light laser, it's treated with spinal decompression, it's treated with frequencies and rife frequencies and so forth. And there's a lot of things that work for very specific, but they don't work specifically across the board for everything. So you have to understand the nature of it. So am I confusing you? Well, there's a lot of doctors out there that are really confused as well when it comes to this. Injury to the nerve may be a direct result of the nerve. In my world, we call it the pinched nerve, or when the spine is out of position, calling a subluxation. Or sometimes if there's damage directly to that nerve itself. So if that's the case, then we have to be able to distinguish whether something is or something is not. These peripheral nerves affect your ability to sense, if you will, your arms, your legs, your hands, your feet. It gives you a sense of balance. It can cause pain that is ridiculous. It just doesn't go away, from a burning pain to a numbing sensation. You don't know where your next step is. Now, the bottom line is that the greatest majority of these types of presentation, treated properly, can be resolved. But when we're looking at numbness and prickling or tingling sensations in your hands, your feet, your legs, and radiating other places, we know that we've got something affecting the long nerves of the body. Sometimes it's sharp, sometimes it's jabbing, sometimes it's throbbing, that hot burning pain that just doesn't want to go away. Sensitivity to even touch, extreme sensitivity. Something, you touch it and they say, well, you might have fibromyalgia. Does that sound, like something you've heard about before? Well, maybe. It depends on, is it isolated to one part of the body? Is it all four quadrants, which is the diagnostic criteria for that? Muscle inhibition, weakness, as you want to call it in the vernacular. Muscle is not firing the way it's supposed to. It can't kick in the way it's supposed to. We talked a little bit about that imbalance, lack of coordination, falling. So then we've got to find out, what are these nerves susceptible to? And the list is huge. And a lot of you can clear up your peripheral neuropathy simply by taking a lot of vitamin D, D3, not D2, which is disulfiram, but D3, lots of it. And I'm talking initially therapeutically, maybe 50,000 units a day. Yes, I said 50,000. Your physicians out there just said, oh my God, what is he talking about? He needs to go to jail. No, not really. I know guys that will give 100, 200,000 units. But we're not talking about, something that is maintaining you. But we all are deficient, particularly in the northern areas. 85% of the people in the northern latitudes, if you will, are deficient in vitamin D. Medications such as HIV drugs and chemotherapeutic drugs, shingles, which is a viral pattern, Lyme, which is a viral pattern, cytomegalovirus, which is a viral pattern, alcohol. If if you drink on a regular basis, at some point, I promise you're not going to be able to sense uh, different sensory discriminatory patterns, hot and cold, and sometimes you can't tell the difference between something that's blunt or sharp. So we have to look at that. Kidney disease, liver function problems, and the one that we hear about the most is diabetes and the destruction of the nerves, and that's one of those things that we need to look at. Heavy metal poisoning, and when we look at your thyroid, all these things have an effect on your nerves, your long nerves, your peripheral nerves, being able to sense, being able to function at very, very normal levels. So when we talk about the nerves that are close to the body, we're going to use the term proximal. And that means that there's nerves that are affecting nerves closer to your torso, your chest and your back and so forth. And those are the shoulders and the arms and the hips, your buttocks, your thighs. Now, in my world, that's something that is straight up the alley of chiropractic and acupuncture and natural therapy, because it often is nothing more than an off-centering, if you will, of the spinal segments. We call that a spinal subluxation. So what's happening with that subluxation pattern? Subluxation means small dislocation, but we're talking about a millimetric off-centering of the bones of your spine, the vertebrae, that allows the nerves to be irritated either by stretch or by pressure. And it can be pressure, one tissue is pressing another, or it can be a stretch and you get an aberration, a symptom presentation from that. So what else would you see? Well, you're going to see weight loss because the body can't facilitate and assimilate the way it's supposed to. You're going to see muscle wasting. It looks like wasting. It can be, particularly in a diabetic pattern, but the muscles aren't firing because it's not getting the neurological signal. Reflexes aren't there. How many times have you gone to the doctor and they've actually taken that little crazy reflex hammer and tapped all of the tendons that are the joint tendons, like at your elbow and your knee and your ankle and your wrists and even in your shoulder and your upper trapezius to see if the muscle fires the way it's supposed to. All of those things can be finger pointing, suggestive if they're not working. But you got to take the time to figure it out because there's a nerve that goes there and that tells you the segment. And now once you know the segment, meaning the level of the spine that might be affecting it, you can make a decision whether it is a structural problem because of an old injury and degeneration leading to something that all of you have heard called spinal stenosis. And all that means is that the hole that the nerve comes out of is getting more narrowed and it's being crushed. And as we've talked about that before, it can happen for a lot of reasons. It can happen simply because of the fact that, you blew a disc. And when I say that in the vernacular, I mean that the disc is bulging. It's putting pressure on the tissue, on the nerve, on the cord, and it's acting like that. It could be the fact that the disc itself is dehydrated because you're not drinking enough water and you're drinking enough, you said, well, I'm drinking. I said, what are you drinking? Well, I'm drinking, 4 or 5 cups of coffee a day. I'm drinking, hot teas. All those are dehydrating. Where's the water? That plain old filtered water in glass bottles that you should be drinking, or at least filtered in a metal container or a ceramic cup. And they look at me like, oh, well, I get a couple glasses a day. Well, let me tell you something. It's not enough. You're dehydrated and the tissue will shrink. Why is that important? Those disc spaces that we talk about in the spine, the soft tissue in between the bones of your spine, they're 75% water. And when you take whatever glass of water that you get, your body's going to go into survival first because it wants to get rid of the waste. Whatever happens to be left over, the disc in between the bones will get. So if you're not drinking water, you've added insult to injury that is significant, and that spinal stenosis now becomes progressively worse until the point where you got real trouble. And particularly you add that to the inflammatory diet that most people eat today, now you've got a real problem. So I want you, this is really an important subject because I want you to get it. I want you to understand that it's not something that you're stuck with. And you may have to have treatment. You may have to have, and we're going to talk about these things as time goes on, use of deactor and laser and spinal decompression and structural balance and manipulation. And all of those things work really, really well. But if you don't give yourself a healing window where you supply the things that you need and eliminate the things that are causing the problem, the pain, the tingling, the weakness, the numbness, the imbalance that you have and so forth will get progressively worse. And if it happens to be something that is tissue destructive, like diabetes, where you start going into neurogenic, meaning nerve originating degenerative conditions, where pretty soon you end up with an irreversible thing, and they start amputating first your toes, then your foot, then your leg. And now what do you got? You have a life that you have to adapt to, perhaps at an older age, and that's less than even, wanting to think about it. So what I'm here to tell you is that these situations can be dramatically reversed if you diagnose them properly and the patient, you, wants to be enjoined a partner with your doctor and to make things happen. At the Roselle Center, we've been after this for years. It's going to be a fun night on December the 11th at 6 p.m. I'm going to co-present with a couple of my docs, and we're going to go over this whole thing in specificity and how it works and what can be done. So join us at the Roselle Center for Healing in Fairfax on December the 11th, 6 p.m., our normal time. And we're going to really show you and walk you through this conundrum and make sure you understand that there's a lot that can be done about it. All you need to do is you can call the office at 703-698-7117. You can go online, one of two places. You go to rosellecare.com. That's ROSELLECARE.com. And you'll go down about, 60%. You're going to see, free healthcare class, peripheral neuropathy, Wednesday, December the 11th. And it'll be the last one for the year. So join us, and we'll have a very special, gift, one that we always do at that class. If we're going to have you the ability to do a discounted evaluation with our docs if you show up, and it's only available for those of you who come to that class. So there's no pressure on anything. We always do it because you deserve it. You need to have the opportunity to say, is there something that I can do that doesn't involve, high price, surgeries? And high price, I not only mean financially, but the cost to your body. But you can also go, by the way, to drtomroselle.com, and you can register there. So you got three different ways of doing it. rosellecare.com, drtomroselle.com, and make that happen. So I'm excited for this class. It's one that I think is very appropriate as we end the year. And, we want to give you the opportunity. We want you to, and here's the beauty about attending these classes. If you come and you decide, no, I'm going to do something else, you have all the information. And people will say sometimes it's like drinking from a fire hose, because we're going to give you the opportunity to really understand what's going on with you and then making decisions and choices accordingly. So I want you to join us, and we're going to get into a lot of different things. As we go into the second part of the program today, meeting in our live stream, and how you go to there, by the way, is just go to drtomroselle.com, and there should be a banner. It'll click up, and you just go that, and it'll take you right into it if you're on your computer, your cell phone. But here's the other piece. Make sure you're following us. Whether it's on Facebook, it's on Instagram, it's on any of the social media sites, even LinkedIn, and you'll find all of our programs there. But it will let you know when I go from this program on 105.9 WMAL into the Ageless Health live stream with yours truly, obviously, and you can do it seamlessly. You're right there. You're right with me, and we can get it taking place. But I want you to understand, again, that what we're talking about in neuropathic pain, there's something, and I want you to kind of put this in your brain. It's called autonomic neuropathy. What does that mean? That means these are nerves, if you will, that regulate the involuntary functions of your digestion, your heart rate, your blood pressure, urination, sexual function, vision, and it goes on. And so if that's the case, and you're having problems with any of these things, could it possibly be that the nerve roots are not able to stimulate these platforms properly? The short answer is, you bet it is. It's one of those things that you have to make sure that you really get it, you understand it. I want you to have the opportunity to start out the new year the right way, the ability to shift and change virtually everything and anything that you do. Wouldn't it be great to have a life back? And I say that seriously. Wouldn't it be great to have a life back? And that means to be able to choose and do and, kind of go into anything that you're motivated to try to get done. I don't know about you, but I think it's kind of cool thing. And, somebody asked me, well, how do you, at your place in life in as many years, how do you stay in a good place? Well, I live with my nutritionist, and she takes good care of me. But I also get treated prophylactically, meaning I get acupuncture, I get structural care, I watch what I eat, I take the right vitamins, and I'm very careful about not eating things that I know that are going to cause an inflammatory reaction, simply because of the fact I've been there, my friends. I've been there. It's not something that is unknown to me, if you will. Having played contact sports throughout my whole life and martial arts and jumping out of perfectly good airplanes and things of that nature, body's taking a pretty good beating. But I don't have to say, oh, what do I expect for all the years I did what I did? What I have to say, what can I do about it now? So the question is for you, what can you do about it now to make a difference? What can you do, to really turn your life around? There's a way. And I want you to join us on the 11th, and I'm going to show you that way. I'm going to show you that you can really, really, truly change your life, change what's going on in your world. We're coming up to that place in the program pretty quickly right now that we're going to shift to the live stream. And just remember, I'm here every Sunday on an ongoing basis for only one reason. One, I want you to get the data. I want you to have all the information so you can ask the right questions of people. But more importantly, you deserve it, and I love you all. Okay, join me right now. We're going to switch over. I'll see you later.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.